Welcome back to the latest episode of Taking Charge of My Cancer podcast. And I have two really fun guests today. Besides my guests, they have been my students for the last 16 and 12 weeks. So this is Micaela and this is Zack. So thank you guys for doing this with me. I really appreciate it. So Micaela Serafin is a third-year physical therapy student from Mary Baldwin University in Staunton, Virginia. She's graduating in May 2025. She completed her undergrad studies at James Madison University in Harrisonburg, Virginia, majoring in health science. She has completed previous clinical rotations in vestibular therapy and skilled nursing. She has one final rotation in inpatient facility, and she's interested in travel physical therapy, neuro rehab, and outpatient orthopedic once she graduates. But perhaps she may end up doing oncology, we'll see. In her free time, she loves playing with her two dogs, Poppy and Luna, cooking new recipes, and traveling. Fun fact about Micaela, she used to live in England and France. So thanks, Micaela, for being here. And then Zack is from Charlotte, North Carolina. He's a third-year PT student at High Point University and graduated from his alma mater of Appalachian State in 2017 with bachelor degree in exercise science and a minor in psychology. He's currently interested in the physical therapist disciplines of orthopedic and military practice. Fun fact about him, he had played hide and seek and the fastest mile life, no allows. So that's really a fun fact. So again, thank you for doing this. And thank you for all the time that you've been here. And I've been really enjoying both of you. So let's start with Micaela. Tell us about you. Were you always planning to be a PT?
I was not. I originally was a pre-med major, thinking about going into surgery of some sort, just trying to be part of patients' progress, but ultimately landed on physical therapy just because I can see patients more often. I feel like there's more of an impact.
Okay. Excellent. How about Zack?
No, I was also not thinking physical therapy whenever I went into undergrad. I was actually went in with a intent of being a dentist. Interesting. Figured out that after my first year of semester doing biology, I hated biology as a major. Was like immediately I have to switch this up. And then I ended up shadowing like dentists more intently, and it was like I don't like this. Like not even close. Then I kind of relayed back on my previous experiences with physical therapy, being an injury-prone athlete. I had, a couple run-ins with physical therapy, and they changed my whole outlook on rehab and what that looks like. And I just kind of fell in love with the process there.
Awesome. Very good. See, all this time and I didn't even know these facts. How about that? Micaela, if you in this, I know you have like no experience with seeing patients with diagnosed with cancer before. If you, whatever you learn, if you can just give to the audience like some valuable tips about, when they're going through their journey from the time of diagnosis to all the time of survivorship, what would that be?
I think the biggest and most valuable tip I could give is take it day by day. It's a long journey, a long process, and it's easy to start looking months and years from now, but it's very important to just take each day as it comes, deal with whatever happens, and then reset and go on to the next.
I think that's very well said. What are your thoughts, Zack?
No, that was very well put. But I would also add that like the happiest I've seen like patient outlook wise are those people that do take a step like day by day and step by step. And those people they're able to attack the day with kind of a poise and honestly a way that kind of inspires me whenever I see them in the clinic. And it's really special to see those people that are in those very difficult situations just kind of pushing forward and living life as it comes at them.
Yep, that's very, very good. And sometimes that's what it is, right? Sometimes can be very overwhelming. And we are not in their shoes, right? So sometimes I'm like, I understand what you're going through, but I'm not in their shoes. I've never been in that situation. Unfortunately, my father-in-law, we lost him to lung cancer. So that was the closest I've been to somebody with cancer in my family. But It's still different, right? It's not you, and you don't know how you're gonna take this news, and you don't. It's a scary process. So sometimes it's hard to take one day at a time, but you gotta see the positive things on one day after the other. So I always tell patients, don't think about the man or the woman that you used to be before all this happened, but think about how did you feel yesterday and how are you feeling today. And hopefully that's gonna feel like, okay, yeah, no, you're right. I'm doing so much better now. Now tomorrow is gonna be a little better. And we may have to have some downtimes where it doesn't feel as great, but then you're gonna get overcoming those days. So I think that's a very good tip right there. Micaela, is any painful lesson that you learn along the way? Not just necessarily through this internship, but in general, just going through PT school.
Wow. Just about this internship, Durley may find this funny, but everything's ortho. And just the flavor of cancer, as she says, and everything. I learned that very quickly. Hard to accept, but everything you should look at with the ortho mindset for PT. And it's just everything else that kind of plays into their treatment and their recovery.
Yeah, I love it because Micaela was one of the students who, when she had not have an orthopedic internship before, and for the audience out there that is not in the PT world, the way that students work is when they go through internships, they have to do certain amount of internships and they have to be exposed to certain things that we're going to be exposed in our careers. And one of the main things that we get exposed, of course, is orthopedic conditions. So when you hurt your back, your knee, your shoulder, that's one of the basics. And then we can do some, acute care, meaning working in the hospital and in the nursing homes and inpatient rehab and neuro. So different things that you go through. But Micaela has not have done an orthopedic one before. So when she find out that this was an oncology internship, she was freaking out. So I don't know how many emails, like, I just want to make sure that this is ortho, right? That I'm gonna have a good experience in ortho because I have not done an ortho before. So I just want to make sure. So it's funny how I'm just remember, 16 weeks ago, looking at this email and I'm like, you have no idea what she's coming here for. And they were like, no, don't worry about it. You have plenty of ortho. So I guess that she learned that on her first day right away. How I always say to people, right? This is ortho with the flavor of cancer because you just have to know more about what these secondary effects of cancer do to you so you can just address that as well. But it's the same as skills. It's the same way that you treat a neck, a shoulder, any part of the body. It's a neuromuscular dysfunction, and you just treat it the same way. It's no different. You just have to make some modifications depending what the patient is going through with cancer treatments at that point. So how about you, Zach?
Yeah. So a painful lesson I learned along the way was that I really did not know much about the cancer population, like at all, prior to this rotation in oncology. And even through like what we learned in PT school, it was the very basics. So coming in here and just doing all oncology was quite a shock, but Durley made it pretty manageable. So
Awesome. What would you think if you guys, and you're from two different schools, which I love. I love as me being exposed to other different programs. You guys interact from different programs and learn from each other. But what feedback would you guys bring back to you guys' schools in regarding what do you think is lacking on your basics to get you prepared? Because oncology it's just now become more and more. And I think it's going to get to the point like all of us are going to end up seeing somebody who went through cancer at one point or is recently going through, and then you're going to come to shoulder pain or back pain or or a neuro component of it if you want to do neuro, and then you're just going to have to start to see what happened with that cancer treatments. So what will be a good tip for you guys to bring back to school and say, hey, we may need to really get in the curriculum some of this oncology. So what will be your thought on that?
I think kind of just looking into and like getting more knowledge on the specific reactions to cancer treatments. That was something that I didn't really know that much on, like radiation, the specific effects of that, and like what that would look like and present like in clinic and how we would handle that and manage it. And then as the same thing with chemotherapy. That's kind of my main point.
I know Zach and I discussed this briefly before, but we didn't have a whole lot of exposure in school, maybe like one class session about oncology. And we briefly talked about like cancer-related fatigue and all that. But I think kind of just knowing how that plays a role into any patient's life and how it can impact you not only physically but mentally as well. I think is the biggest component to their recovery.
Great. So feedback to schools. So hopefully they can change that. I keep telling UF here all the time. And it's like, I think that that's going to be such an important component on it that, like I say, cancer treatments are getting better and better. So we're going to have a lot more survivors, meaning that we're going to have more patients in outpatient that has been going through a lot of these treatments. And if we don't know how to treat them, we are not going to really be super successful with their recovery. So I think it's important for us to move on with medicine is moving on and the outcomes and the increased timing for survivorship on any patient diagnosed with cancer. So I think that's going to be really important. So what did that mean to advocate for yourself and how can people do that, Micaela?
Advocating for yourself, putting yourself first. I am big advocate for advocating for yourself and just knowing when to put yourself first, making sure you make time for your interests, your hobbies. Of course, it's important to make time for your family and others, but overall, it's your health. You know your body best, and you gotta put yourself first.
Okay, what are your thoughts, Zach?
I mean, I'm going to be saying essentially what Micaela said, but in slightly different words. But to me, it's, standing up for your own interests, and especially whenever you find yourself in a situation where you feel like those aren't being a priority, you definitely need to take that time. And like, if that means reaching out to another provider, trying to get a second opinion, we've had that happen with patients here. And then kind of like Micaela said, just taking time for yourself, realizing when you need to reset and when you need to just process things.
Yeah. And again, I know that we have to trust our physicians. We are trusting whoever is telling us that we need to do ABC because that's what they went to school for. And that's who, we're supposed to be trusting. But unfortunately, right now, with this healthcare system and how busy sometimes physicians are, sometimes they don't have the time to really explain things in detail. I don't blame them at all. It's just the way that it is when you have so many patients and so many people to process. Is that the right thing to do for the patient? No, but sometimes I tell patients, you know what, just write a list of things that you have for your doctors and tell them, you're not rushing. You're going to spend time with me here. And I want the answer for these questions. Again, has to be valid questions, right? So just make sure that you search first out of good resources. So not Dr. Google. So, but perhaps, American Cancer Society, some really good, valid medical resources. So you have real, information that you can say, I understand this or I read that. What are your opinion on ABC? But just again, don't be afraid to ask the doctor questions, right? So they may know more than you, but you know your body better than anybody else. So just really don't really let that hold in you back. Okay. Talking about resources, what are good resources for patients to educate themselves?
Well, shameless plug, but this podcast literally has interviewed a plethora of different physicians, patients, and students. So a lot of good information on this, but also the Breast Cancer Research Foundation puts out some really good research, new and upcoming stuff. Always good to look at some credible sources instead of Dr. Google, like Durley mentioned before.
One resource that I just kind of found myself using because I made an in-service presentation, part of our clinical here. Some of the kind of facts and statistics that I got was from the American Cancer Society. They have a lot of good resources and a lot of kind of ways that you can get more information regarding cancer and other diagnoses such as those.
Perfect. So let's talk about in services a little bit. So Zach did a really good job talking about osteoporosis and osteopenia yesterday. So Zach, when you came in here, you knew about what osteopenia and osteoporosis was. Did you ever thought about linking that with cancer treatments?
No. I'll just be blunt. I did not. And it makes a lot of sense now that I know more about cancer treatments and specifically like how they interact. And those, that kind of immediately come to mind are like aromatase inhibitors and like the hormone blockers. But yeah, no, I had no clue.
So if you wanna give a little information, like a little summary in a couple of sentences from your in-service yesterday.
Yeah.
So a lot of our audience can be, patients with diagnosed with cancer, and a lot of them is breast cancer who are estrogen or progesterone positive. So they are in what we call hormone blockers, either tamoxifen or other aromatase inhibitors. So you want to kind of tell them a little bit what does that means and why is that creating some weakness on the bone?
Yeah, so when it comes to osteoporosis and osteopenia, that's essentially a crazy word for just saying you are at lower bone mineral density than the typical population. So what that essentially means is it puts you at a greater risk for injury, specifically with falls and fractures. And specifically the hip, which is the most fatal and the most costly to the medical system and yourself, mentally and physically. So with that, those hormone blockers, they essentially interrupt the bone remodeling process of like osteoclasts, osteoblasts. If you want to look those up and get more into the specifics, those help build bone and remodel and adapt to the load that you're stressing your bones under. So those hormones essentially just kind of interrupt that process and make it less efficient. That way, whenever your bones are remodeling, they're not remodeling as strong. So that's kind of essentially how osteopenia and osteoporosis kind of comes about in very simple, kind of hopefully short enough terms.
That's very good explanation. So Micaela, what can we do as a physical therapist to try to help that?
Impact training. As I learned from Zach's in service and also just my time here, resistance training and impact training can really help build the muscle. So anytime build the bone. So anytime muscle is pulling on the bone, it strengthens it. So that's primarily what we try to educate our patients on and incorporate into their day-to-day lives.
And what type of tests do we use to try to get patients understanding a little bit about their body composition?
So we have a machine called the InBody. It uses a small little electrical current to assess the weight, your skeletal muscle mass, your body fat percentage, and a whole bunch of other stats. But we usually put patients on that prior to treatment and during treatment and usually after, just so they can track their progress, use it as an educational tool to kind of see where they are now and what we can work towards.
Excellent. Very well. I see how much you guys know now. That's awesome. One important thing as well that I think is important, and some patients don't realize that as you're going through chemotherapy, right, it is something called chemo-induced neuropathy, where you start having numbness and tingling sensation on your feet because a lot of the taxols create this toxicity. So imagine that you don't feel your feet any longer or decrease the sensation on the feet. That definitely put you in a higher risk for falling. And if you already start having issues with osteopenia or osteoporosis, that means that we are gonna then have you in a very high risk to actually bone fractures, which is not a good thing. So we know that a hip fracture really can deplete your quality of life and actually lose your life easily. So again, all this together, meaning that if you end up having any type of Taxol medication during chemotherapy, talk to your physician about a referral to PT, because there's so many things we can do to hopefully try to mitigate some of those effects, improve your strength, improve your balance, decrease your fall risk, decrease the possibility of a bone fracture. So many things we can do being proactive that then just treat you after you already perhaps had a fall, break a bone. So definitely something as well for you guys out there to ask your physicians about. How can people find you, Micaela?
LinkedIn.
Okay.
That's pretty much what I use for any like professional or school contacts. So just my first name and my last name. And Durley, I think she's going to link that in the podcast description. So to find me on there.
Okay, perfect. How about you, Zach?
Same way, LinkedIn. So
Okay.
first name, last name. Separate maybe my full government name, Zachary, instead of Zach.
Okay.
But yeah.
Okay, perfect. And I'll put that on the show notes. What is one question you wish I would have asked you and you will have answered, Micaela?
Do you plan on working in oncology now and staying with this field? The answer, I don't know. I'm still very open to it. I'm still kind of testing the playing fields with a whole bunch of specialties, trying to find my niche, but this is still on the list. It's very interesting. I think more and more research is going to come out about how PT impacts survivorship. So maybe I'll be a part of that.
I'm sure you will. So I always say to my students, my job is to really teach. I love to teach, as you guys know, but my love is to be able to, or my goal is to be able to show students what is the huge importance and impact that we can create in patients that are been going through cancer diagnosis, show them some really good tools, and definitely get them to fall in love with this population, and then hopefully spread them out, right? Because then it's so much easy to know, oh, you're coming from Virginia. I know exactly somebody in Virginia that knows what she's doing. And even if you end up not doing this, like oncology full time, I know you're going to be exposed to oncology patients. And I can tell you how many students I can really have, it's a handful that has been reaching out to me and say, they want me on my new job to open a program, and I want to do something exactly for what you guys have there. What do I start? How do I start this? How can I put you in contact with somebody? Which I love it, because I think that is very lacking. I mean, you guys already know, since you've been here, right? We have people from all over the place, and they have to drive 4 hours to us because they cannot find anybody that does a specific oncology and has the knowledge and the mix of the, skill set that we have to be able to offer them that. So I think that we need more PTs working on this specialty. That's why I always say, my goal in life is to convert every one of my students to be oncology therapists. So I hope we can do this podcast in a few years and say, tell me what field are you on now? And then hopefully it's going to be oncology. So, but yeah, great. How about you, Zach? Any question that you want me to, that I will have asking you?
Yeah. I would say what was my favorite part of this clinical experience, and I would say that's an easy question because it's the patients, like by far.
What?
They are
It's supposed to be
yes.
me. Well, what's
I'm
wrong with
sorry.
you?
I'm sorry. I'm offending. But they were the most encouraging and rewarding and dedicated people that I've ever had the pleasure of working with. It was awesome seeing them come in, and they would genuinely like tell me everything. Like Micaela is a patient that comes in with a whole list of all the things that he's done every single day from like the hour. It's crazy. It like crazy in a good way. I'll get that out there. But like they come in with a poise for physical therapy that's like very refreshing, and it's nice.
Kind of going off of that, I actually discharged a patient today. We all got teary-eyed when she left. Like we saw you at the very beginning, kind of not being able to do any of her daily activities. And now here she's back to better than normal. She's pain-free. She's back to her full function. And it's just very heartwarming to see the progress that these patients make and the impact we have on their lives.
Yeah. Absolutely, and you're right on the dot. Yeah, so that was the best thing about this population. Again, like I mentioned before, I did orthopedics for so many years, and when I got exposed to this, I was like, I have no idea about what I'm going to do with these patients because I don't know anything about oncology. I did ortho and I did other specialties prior to this. I have no clue. And that's exactly what I fall in love with the patient. On the first week, I was just kind of really here shadowing with one of my colleagues, Shannon. I was like, oh my God, this is the more reward I have feel like in a week, just shadowing somebody that my actual patients that I'm dealing with every day in ortho. I'm not saying that it's like that all the time in ortho, but it's just different. I think that when you've been diagnosed with a cancer, your perspective of life totally changed. So you just don't sweat the smallest stuff any longer. It's just, you just really value more what is really important. And I think that that's exactly what they do. They're just really fighters. They're just like, I just want to do better, and sometimes they go through rough stuff. I mean, you guys seen Micaela, your in-service was about, free flaps on head and neck cancer patients. And this is talking about taking a muscle from your chest, you're taking a piece of your scapula, a piece of your leg to put on your jaw. It's a major surgery. And these surgeons are amazing. Like, how you do all this to get rid of the cancer and to get somebody to be able to talk again and to swallow again and to eat again and to move their head again and to move the arm again. So, I think that they just go to a major thing that I feel like a lot of them feel like therapy is like the light of, no, it's like the lie of the day. It's like, yes, I just went through this chemo and got poison, and then I got to this radiation and it's making my skin miserable. And I come here and I feel so much better after I get out of here. So I think they're looking forward because we offer that and the ability to really listen to them because again, it's a busy life and then we get to spend more time with them and talk to them and the psychology piece is so important. So for them to be able to trust us and us and then just bend in what they're going through, I think it's just really great to see them. So yeah, we have some rough times, right? We have sometimes patients who they're just having a rough day and we just gonna have to take it as it is. But again, sometimes it's just no matter what, they always wanted to work really hard for us. So yes, you're right. This is one of the favorite things, and that's why I'm so in love with this. So for the last 17 years, this is what I've been doing. So again, that was so much fun. So this is the first time I do with two people at the same time. I really, really enjoy it. Thank you again for doing this, for being part of this show, for being part of this whole last 16 weeks internship and all the hard work you guys put into this internship. I'll appreciate it.
Well, thank you for having us.
Yeah.
Absolutely. Okay. Thank you. Bye.
Bye.